distinguished President of the General Assembly, Professor Folklers and Professor He Wen, and distinguished ultrasound doctors from both China and the United States. Good morning. I'm Dr. Fei Xiang from Ultrasound Department of PRA General Hospital, the first medical center. And at present, the prevention and the control of the outbreak caused by the COVID-19 is in critical condition. The Chinese ultrasound doctors have been aware of the importance of protection since the beginning of the epidemic. The CUDA organized experts to write Chinese expert consensus on protection for ultrasound healthcare workers against COVID-19. So today, it's my great honor to introduce and analyze the prevention and control experience from China to you with the help of this meeting. And we know that COVID-19 is now a worldwide public health problem. In the early morning of the March 12th, the WHO officially declared COVID-19 a pandemic. It is highly contagious and spread rapidly with a wide scope of outbreak, making the prevention and control very difficult. And in the early stage, more than 3,000 healthcare workers have been infected in China in the early stage due to the lack of awareness of the infectivity and insufficient protective measures. But now, more than 40,000 healthcare workers across China have ridden to the rescue in support of Wuhan City in Hubei province. And so far, there is zero infection among these doctors. Therefore, effective protective measures are very important. So, I will introduce our prevention and control experience in 3 aspects: workspace, ultrasound equipment, and doctor's personnel protection. And firstly, let's look at the workspace. The workspace in ultrasound department should be divided into 2 areas. It includes 2 passages and 3 sections. 2 passages, the one passage for the access of the medical workers, and the other for the patients and his families. 3 sections are clean areas, buffer zones, and contaminated areas. This is the sketch map of 2 passages and 3 sections. The clean area is for healthcare workers to rest, eat, change clothes, and so on, where irrelevant persons are strictly forbidden to enter. Any work clothes, masks, hats, gloves, shoes covers, and so on used in the office are not allowed to be brought into the clean area. A buffer zone is mainly for preparation, including putting on or take off protective items. And here we need to focus on the buffer zones. And from this picture, we know the buffer zone is divided into 2 parts, buffer zone A and B. Buffer zone A is for putting on protective gears, where buffer zone B is for putting off the protective gears. But in the buffer zone B, and we can know that the buffer zone B is further divided into 2 parts, B1 and B2. B1 is for taking off eye protection or face shields, protective clothing, boot covers, outer gloves, and so on. The B2 is for taking off work clothes, isolation gowns, hats, inner masks, inner gloves, shoes covers, and so on. And the people, when entering into the hospitals, follow the route starting from the clean area, buffer zone A, and to the contaminated area in order. The process is reserved when exiting hospitals. Contaminated area buffer zone B, and clean area. And in triage area, the staff should be provided primary or secondary personnel protective equipment, short for PEE. Protective items include surgical masks or medical protective masks, for example, the N95 masks, eye protection or protective face shields, latex gloves, disposable work hats, work clothes, and isolation gowns, disposable shoe covers. Hand hygiene should be strictly performed during consultation. Now, this is very important. Now, in the triage area, in addition to following the normal process, the staff also needs to do the following work. Ask for medical history symptoms. Check the temperature of the patient and report any case where the patient has fever and suspected symptoms. Ultrasound consulting room environment. There are three measurements are very important for the ultrasound consulting environment. The one is make the room well ventilated at least once in the morning and once in the afternoon for no less than 30 minutes each time. And two, disinfect the ground and the surface of objects in the room with chlorine containing disinfectant or diluted it for disinfectant at a ratio of 1:50, 1 or 2 times per day or at any time once it is contaminated. And third, disinfect the air with UV lamp irradiation for 6 minutes after the end of daily diagnosis and treatment. The above 3 points are very important for the disinfection of consulting room environment. Ultrasound equipment. For the US equipment, we use 97% alcohol or 3% hydrogen peroxide. Sterilization of ultrasound probe is very important. 75% alcohol or disinfectant wipes are used for disinfection. And the supplies for patients are another thing that we should focus on. Changing these supplies at least once every half a day or intermediately once they are contaminated. Of course, it is recommended to use this